Insurance companies and hospitals had said to pay for the cost of testing and treating COVID-19, they would foot the bill. So why has a Central Virginia man received $1,200 in bills for his testing? And tonight's Working on Your Bill brief season uncovers a critical detail the hospital and insurance company both missed.
It was like 941, 947, something like that. And then later I got an emergency room doctor bill, and then I got a bill from the urgent care facility I was at.
And as you're getting these, what are you thinking?
I'm thinking, this is crazy. Why am I getting bills? I thought, it was taken care of.
Scott Meyerhoffer of Appomattox is one of millions of Americans who showed symptoms of COVID-19 last spring and sought out testing big insurance companies and healthcare providers vowed to pay for. Yet Scott kept getting bills and no one would explain why.
Weeks go by, months go by, you haven't heard from anybody. So I call back again. I'm still getting bills. They're sending bills out every month. And I said, I need to talk to someone about this. And you can't get anybody on the phone, so it doesn't do any good.
The problem solvers got his insurance company to respond. They said the providers never charged for a COVID-19 diagnosis or test. Instead, itemized bills show the hospital charged for things like an IV and an electrocardiogram. But Scott knows he was swabbed for COVID.
But she's looking in there, and she's got the swab and a little light and stuff. And after she puts it in there, and I didn't have much of a reaction, she's like, well, did I get all the way back there? And I'm like, I don't know. You're the nurse. You're looking. You should know if you got back there or not. Someone from the hospital, about 2 or 3 days after my visit, did call me and say I had a negative test result. And I didn't even believe that. Since I didn't think it was an accurate test, I'm thinking, I think I had COVID.
Scott was able to get a copy of those results sent to his insurance company and finally received an explanation of benefits showing the hospital visit is now paid.
What I feel bad is I think about the people that get a bill and don't even question it and just pay it, whether or not they're even able to financially, whether or not it's even the right for them to have that bill, and they just pay it because they don't question when they get a bill from a doctor or hospital.
Scott started asking questions last April in what was the early days of the pandemic. Last month, the problem solvers reached out to Lynchburg General Hospital and Scott's insurance company, Piedmont Community Health Plan. Both companies vowed to correct the mistake and say Scott should not owe any of the nearly $1,200 he was billed. Working for you, Bree Season, CBS 6 News.
If you have received a medical bill you were not expecting, we want to know about it. Send the problem solvers with as many details as you can include by visiting WTVR.com/yourbill. We'll be in touch if we think we can help.